Hey, what's up guys, it's Junior. The use of artificial intelligence is more prevalent in our lives now more than ever, and healthcare is no exception. There's been a lot of adaptations of AI in the physical therapy world as well. In this video, we'll check out how ChatGPT would treat a patient with sciatica, and I will share with you whether or not I feel threatened by it. After all, ChatGPT is a PT as well. Sorry, that was bad. Anyways, my name is Jin. I'm a licensed orthopedic physical therapist in Maryland. And be sure to subscribe to my channel if you haven't already, if you want to get insights on physical therapy. Alright, so what is sciatica? Sciatica is an extremely common condition that we see in the orthopedic physical therapy setting. And it is because your sciatic nerve that starts from the spine gets impinged somewhere along the way, all the way down to the leg. And so you may experience nerve-related symptoms like numbness and tingling that travel down the leg, in the back of the leg, or sometimes the side as well. You may have some general discomfort in your back and in your hip, with movement, and laying down or sitting down for a long period of time will definitely give you some back pain with sciatica. Going to physical therapy and doing the right exercises is an extremely more efficient and affordable way of treating the symptoms that sciatica can give you, as opposed to going the surgery route. And you might be thinking at this point, but hey, are we not going to address the root cause of it all? Are we just going to ignore the fact that the nerve root that comes out of your spinal cord or somewhere along the way that's getting pinched? Are we just going to ignore that? It's a valid question, but I will say to that question that research has shown over and over again that the symptoms that patients experience don't always correlate to what is shown through imaging. So imaging as in MRI results and X-ray results don't always correlate to the symptoms that the patients are feeling. It's very difficult to pinpoint to exactly what structure is contributing to what kind of pain or what kind of symptoms, and on top of that, there's no guarantee that if we address the root cause of it structurally, that it will result in functional improvement. And so the thought process there is, if we can address the symptoms and our body can learn to adapt to it with physical therapy, the problem will be solved. So here's what I got when I asked our friend ChatGPT, I have sciatica, what are some physical therapy exercises I can do? ChatGPT gave me 5 exercises: the piriformis stretch, knee to chest stretch, cat-cow stretch, pelvic tilts, and seated hamstring stretch. Now, I think the AI was pulling from different sources online. There are many videos out there, many articles written about sciatica since it's such a common diagnosis, and patients sometimes use that to educate themselves. And I will say these 5 exercises are exercises that I will probably give my patients with sciatica somewhere along the way. It's not completely random, and it does address some of the structures of your body that is problematic. But is this all there is to it though? Definitely not. This is just a small piece of a big puzzle. Alright, so here are my thoughts. I personally use ChatGPT quite frequently if I'm looking for a general starting point to a question that I have. And I think ChatGPT can serve as just that. If a patient is looking for a good starting point on how to educate themselves on how to best manage sciatica-related symptoms, ChatGPT would be a good start. So a better question to ask ChatGPT would be, what is sciatica, or what causes sciatica? More general questions, because even though you're coming in with the same diagnosis of sciatica, treatment plan would vary tremendously depending on who you are. We're not really treating the diagnosis, we're trying to treat the person in front of us as physical therapists. So to generalize our treatment plan for physical therapy into 5 exercises can be a bit problematic. Now, that's not to say I don't see any good coming out of the AI and physical therapy collaboration here. I can see a good use for this technology for patients that are more experienced in physical therapy and they just want to brush up on some exercises they've done in the past. Let's just say that you're a patient working with me because you have sciatica. You got better in 6 to 8 weeks and we've discharged you. 5 years from now, you're on a road trip, you're driving somewhere, and you've driven for 6-7 hours and your back starts to flare up again. If you're looking for a quick reminder just to brush up on some exercises that you've responded well to before, ChatGPT would be a great starting point. You can always go on ChatGPT and look up some exercises that's worked for you in the past, just to remind you and remind yourself on what exercises you can do to help alleviate the symptoms. Another good use for AI in the PT world, assuming that the database provides reliable and evidence-based information, is looking up protocols that are more generalized. Some questions you can ask here for more standard diagnosis is, when can I start PT after getting a total knee replacement surgery? Or what are some things I can do in the first 48 hours of a mild ankle sprain? Long story short, ChatGPT cannot replace physical therapists, because you're more than just a diagnosis, you're more than just a code with a bunch of numbers. It's going to take more than 5 exercises to get you better. I can definitely see how AI and ChatGPT can improve the experience of physical therapy in the near future as AI collects more data and it can generate a more comprehensive treatment plan. It's a technology that we can definitely take advantage of if AI can provide us with reliable and evidence-based information on how we can educate ourselves better on our health and our well-being. I hope that was interesting. If you guys have any questions, you can leave it in the comment section down below, and I will see you guys on my next video.